you all for being here today. My name is Alex. I'm a registered dietitian at Align Modern Health, and I'm so excited to be giving this talk today. So we'll talk about how to nutritionally reset, and I will discuss the pros and cons of some very popular diets I'm sure we've all heard of, maybe across social media, through word of mouth, your own research, and so on and so forth. But first, I want to talk about integrative medicine and the services that we offer at Align Modern Health. So Align Modern Health offers a variety of services since we look at each and every patient, not just from the perspective of the symptom, but as a whole person. So there's a physical medicine team, which is comprised of chiropractors, rehab specialists, acupuncture, and clinical massage therapy. And they treat and work with a variety of conditions, some of which are listed. Then we have a functional medicine team, which is made up of functional medicine physicians and clinical dietitians. So whatever symptoms you may be experiencing and want to get checked out, we really do have services that cover all the boxes. So again, I'm Alex. I'm a certified and licensed registered dietitian. A little bit about my background. I received my bachelor's degree in nutrition science from UIC. And from there, I completed my master's degree alongside my clinical dietetic internship through Benedictine University, took state boards, and now I am practicing as a functional medicine registered dietitian at Align. So the functional doctors and I work side by side, and after they conduct an assessment, complete the appropriate testing that would be necessary. If there are any nutrition implications that would benefit you, that's where the clinical nutrition team and I come in, and we work on any dietary or lifestyle modifications that we think is necessary. Okay, so let's get into the diets that we're going to discuss today. I'm sure many of you have heard of some, if not all of these diets, but today I want to discuss the pros, the cons, as well as some considerations to take into account if you're looking to try these. So we'll go over the keto diet, Whole30, paleo, intermittent fasting, and detoxing. After this, hopefully, if you were thinking about trying one of these, you can narrow down if it's right for you and the goals that you want to achieve, as well as if it can fit into your lifestyle. So let's start with the ketogenic or the keto diet. This diet was originally intended for epileptic patients as it has favorable evidence showing reduction in seizure occurrence. However, it did rapidly gain a popularity for a means for weight loss. This diet is essentially a high-fat diet, which results in low carb intake. And it was initially designed using a fat to non-fat ratio of 4:1 or 3:1, where about 90% of your calories are coming from fat. And that's the diet that was prescribed for epileptic patients. But today there are modified versions where about 75% of your calories are coming from fat, which would lead to about 30 grams of carbs per day, which is a little easier for weight loss seekers to follow. But overall, this is a high-fat diet, and since carb intake is minimal, this leads the body into ketosis, which is a state where your body produces ketones from fat, since carbohydrates are no longer the primary source of energy. The majority of this diet is fresh meats, eggs, cheese, fish, heavy creams, butter, oil, nuts, and seeds, and then starchy vegetables and fruits are added in small amounts. So let's go over the pros of the keto diet. So first off, it can kickstart weight loss. So when we lower our carb consumption, we start to lose the stored carbs that lie in our liver called glycogen. And we also lose the water molecules that are attached to them, and that all weighs. So typically there is a quick amount of weight loss that occurs right off the bat. However, it is important to understand that a large portion of that is water. This diet can help balance blood sugar, especially for people who enjoy carb-rich foods that frequently spike our blood sugar, like white refined products, such as potatoes, white rice, pastas, breads, high sugar granolas, and desserts. So removing those specific types of carbs from our diet can result in better regulation of blood sugar and prevent spikes and drops throughout the day, leading to less fatigue, less energy crashes that are often seen with blood sugar dysregulation. This also can help increase focus for that reason. But as for diabetics and other patients with high insulin levels, this diet does help lower the demand for insulin, which in turn can help lower insulin levels and improve labs associated with diabetes. And lastly, it can help decrease seizure occurrence, which is how the diet originated through the process of inhibiting neurotransmitters. Onto the cons of keto. So this diet is definitely not an easy one to maintain. Food is something that surrounds us all day. You know, we think about where we're going to eat, when, how it's going to be prepared, and then adding in the stress of removing carbohydrates, which are some of our favorite foods, can be challenging and can cause a poor relationship with food. Food for a lot of people is an aspect of social gatherings, and having dietary modifications can be hard to accommodate in certain settings. Also, this diet can be high in unhealthy fats that are saturated, and it can contribute to cardiovascular disease over time if the intake of saturated fats like butter, high-fat meats, and so on is high. So overall, talking with a medical professional about starting a restrictive diet like this is important, especially if you have any medical diagnosis that results in fat malabsorption or a diagnosis that would benefit from a low-fat diet, such as gallbladder or pancreatic diagnoses. And also a great source of fiber on this diet, which can help regulate bowel movements and GI motility, are nuts and seeds. So if you have an allergy or a sensitivity to any of these, that needs to be considered as well. And dehydration is also a very common side effect of the keto diet. So one carb store is surrounded by several water molecules. So when we deplete these stores through the process of the keto diet, that can result in dehydration through water and sodium loss. So another reason it is important to work with a dietitian and or a medical professional so we can accurately calculate your fluid needs and monitor your hydration markers. And then removing high fiber foods like starchy veggies, fruits, whole grains can significantly increase your chance of constipation and the development of other GI symptoms. Carb sources are very nutritionally dense, full of B vitamins and other essential nutrients. So another reason it's important to work with a medical professional is to ensure that you're supplementing the necessary vitamins and minerals to avoid deficiencies. This diet, when adopted long-term, can cause adverse side effects like low blood sugar, low energy, and then any other symptoms that we associate with being quote unquote the keto flu. Diabetics specifically should only attempt this under medical supervision to reduce the risk of DKA or any other blood sugar concerns. There are a lot of short-term studies on the keto diet and very few on the long-term effects, but the ones that I have read do result in low blood sugar and its associated symptoms. So overall, the keto diet is one that can benefit specific people who may want to kickstart weight loss or who currently consume a carb-heavy diet and want to explore other food options. However, it is important to understand that this is not long-term sustainable answer for weight loss, and there can be side effects. So on to Whole30. This is a 30-day elimination diet that focuses on whole, unprocessed foods like fruits, vegetables, protein, and healthy fats, while avoiding processed foods as well as grains, dairy, beans, legumes, and additives that are commonly found in packaged and processed products. After the 30 days, you add in one food or food group at a time and monitor any reactivity to narrow down food triggers and sensitivities. Pros of this diet is that it emphasizes real food without increasing or decreasing specific amounts of carb, protein, or fat, which makes it a lot easier for preparing meals and snacks. There is no need to measure certain food portions. There's no specific timing of meals, which can lead to a healthy relationship with the foods that nourish our bodies. Fruits, vegetables, healthy fats, and protein can have significant anti-inflammatory effects, which can decrease risk for disease development and promote an overall healthy state. And since our macronutrients, carbs, protein, and fat aren't limited, we can still get plenty of vitamins and minerals on the diet. So as long as you incorporate variety through the foods that are offered, supplementation is not necessary unless there was a pre-existing deficiency. And overall, with refraining from consumption of processed foods with lots of what I like to call empty calories, this can lead to healthy weight loss. A con of Whole30 is that it is very restrictive and essentially there is no room for error. since the guidelines require no cheating during the course of 30 days. This can lead to cravings, binging on non-compliant foods, and overall not being successful with the guidelines. And this also requires a large amount of meal prep. So there are a lot of popular foods that need to be avoided, like grains and legumes, as well as additives that are in sauces and oils and dressings that are largely utilized in restaurants and takeout. So to ensure 100% compliance, it is best to cook from home or to do some research about the food services in your area that have compliant options. And along with taking time to plan meals and snacks, I would encourage anyone doing this diet to block out some time for grocery shopping. Looking at labels, finding compliant alternatives. That's essential to ensure that you're avoiding any of the hidden ingredients that don't comply with the diet. Avoiding sugar and alcohol can lead to withdrawal symptoms, like headaches, fatigue, overall developing some potential flu-like symptoms, especially if they were consumed in large amounts prior to starting the diet. And this diet is not suitable for vegans or vegetarians, since the primary protein sources like beans and legumes are to be avoided. So overall, Whole30 can be a great option for a lot of people, and it incorporates lots of healthy foods without restricting certain macronutrients. However, it does call for strict compliance. So this can be difficult for some people to achieve, and it isn't necessary in order to achieve healthy, sustainable weight loss if that's your goal. Onto paleo, which is super similar to Whole30 and avoids the same food groups. However, there is no timeline and you can still enjoy your favorite foods, and it doesn't result in having to start over as it's required with Whole30. The diet consists of lean meats, fish, vegetables, nuts, seeds, and grass-fed animal protein. So foods that were thought to be easily obtained through hunting and gathering during the Paleolithic period. The benefits to paleo are similar to that of Whole30 since you're avoiding the same food groups. The rationale behind this is that lean meats, high fiber fruits, and vegetables, as well as nuts and seeds, will provide the feeling of fullness and create that lack of desire to overeat. This is particularly beneficial for patients with inflammatory conditions like autoimmune disease, as well as cardiovascular disease, blood sugar dysregulation, and people who are looking to lose weight. Cons is that this diet can be very meat heavy. So those who don't like to consume a large amount of meat or meat at all, like vegans and vegetarians, or have conditions where lowering meat consumption can be beneficial, such as patients with gout, may find it hard to find sufficient calories. Eliminating grains and beans is taking a huge chunk of fiber sources out of your diet, which are also very nutrient dense in the vitamin and mineral department. So long-term paleo dieters should be aware of their vitamin and mineral status and supplement accordingly. Some common deficiencies can be calcium and vitamin D with the elimination of dairy and beans or legumes, which over time can increase your risk for osteopenia and potentially osteoporosis if you don't address it. So to wrap up, the paleo diet is less intense compared to Whole30 in the sense that it does lack a time frame and it doesn't require 100% compliance. But this also, similar to every diet that we're going to talk about today, can be challenging to eat in a social setting or a restaurant if others don't share the same dietary preferences. And it also cuts out grains and other delicious foods, which can be difficult and not easy to do or necessary to do if the goal is general weight loss or health maintenance. Intermittent fasting is next, and this is restricted eating during specific timeframes, followed by feasting or unrestricted eating. This comes in a bunch of different variations, which we will go over. So there's different types of intermittent fasting. There's a 16-8 fast, there's a 12-12 fast, where you're not eating anything for those 12 or 16 hours, only 0-calorie beverages like black coffee, herbal tea, and water. And then during that 8-hour or 12-hour feast window, you're consuming your standard caloric needs. There's also a 5-2 version where there's days of restrictive eating, where you're taking in about 500 or 600 calories a day, followed by unrestricted days where you eat as you normally would. And these are just a few of the varieties that are out there. So there's definitely lots of up and down opinions about this diet, and also a lot of research on the potential benefits it has on specific conditions. So this can be used as a short-term weight loss strategy, as well as lowering insulin levels and reducing the risk of cardiovascular disease through lowering blood pressure and or cholesterol. However, there is research to show that once intermittent fasting is stopped, that blood pressure or cholesterol can return to the value it was previously to starting the diet. This is easy to do since essentially you aren't prepping meals. You're kind of doing the opposite, maybe skipping a meal like breakfast. And there is no limitation on the foods that you do eat. It's all based on the timing of the fast. So essentially, during your feast window, you can be eating whatever you want. This is also an easy way to reduce calories. So if you're someone who tends to graze at night or overeat during specific times, it would essentially eliminate that during whatever period you are fasting for. Cons definitely include an increase in hunger and cravings since you're not intaking any calories for an extended period of time, which can lead to low energy and fatigue. I've also seen a lot of patients who try intermittent fasting and they begin to develop a lack of hunger, which is concerning metabolically to me. Not eating for extended periods of time can put stress on the body. Blood sugar dysregulation at either end can trigger an inflammatory response and affect cortisol levels. So this diet is definitely not for everyone, especially people who have an increased calorie needs like pregnant women, athletes, or kids who are still growing, as well as anyone who has experienced disordered eating, as well as those with a cortisol imbalance. So intermittent fasting, I would say, is beneficial for people who graze and eat out of boredom and maybe have trouble with the timing of their meals, but it can be harmful for specific populations. I would suggest if you're trying to fast, starting where you're not eating at 8 p.m. and then you eat and break that fast at 8 a.m. And going from there if approved by your dietitian. Okay, so let's get into our last diet of the day, detoxing. So some people choose to self-administer detox programs for weight loss or to improve energy or to eliminate toxins. So the first one that I want to talk about is juice cleansing. This protocol is exactly how it sounds, where you're only consuming calories in the form of juice. This can last for however long, but typically it's between 3 and 21 days. The juices are typically very high in vitamin and mineral content, but lower in macronutrients like protein and fat. Juice cleansing can lead to you feeling hungry and other signs of low blood sugar like irritability, headaches, brain fog, fatigue, and sleep disturbances. These are also typically low in fiber, which can cause GI issues like constipation or diarrhea. And these are typically very low calorie and leads to fast weight loss. But this by no means is a healthy route to sustainable weight loss and should be avoided unless otherwise directed by your healthcare provider. Colon cleanses are next, and these detoxes aim to essentially clear out your colon. It can definitely be very harsh on the body since we're clearing out the colon. There can be lots of bowel movements that aren't necessarily pleasant to pass, and this should definitely only be attempted if prescribed by your healthcare provider. Marketed colon detox programs usually involve laxatives and diuretics, which promote weight loss and support rapid elimination. However, the rate of bowel motility isn't directly translated to the rate of liver functionality. So if you have a health concern that you suspect is related to toxins, work with your healthcare provider to confirm that that's the case and not potentially allow an undiagnosed condition to worsen. Liver detoxes are next, and these are intended to support the natural detoxification processes that the liver already does for us. So some reasons that doctors would prescribe detox programs would be for a specific clinically indicated purpose, like hormone imbalances coming off of drug or alcohol use, etc. It can help develop better eating habits. Any benefit from a general detox program ties back to the transition towards eating more fresh, whole, nutrient-dense foods, which is good for anyone to do. But there are risks and side effects to all programs, which is why it's important to work with a healthcare provider and make sure that there is evidence for the initiative and that safety concerns are ruled out. In general, not advisable to self-detox without a medical reason for doing so. So that wraps up our list of just a few diets. I want to go over some tips for a general healthy you. Dieting is not for everyone, and it definitely does not have to be. So working with your dietitian and your healthcare provider can give you clear insights if you are interested in trying one of these, if they are right for you. However, it is possible to lose weight and reach any other goals that you may have for the new year, not by dieting and just by developing more sustainable eating and exercise routines. So here are just a few general tips to get that kick-started. Avoid processed foods and added sugars, and limiting alcohol. So when we're looking at the nutrition label, added sugars is on there now, making sure that's as close to zero as possible. Drink plenty of water. Regular water and herbal tea would count towards your fluid needs for the day. Soda water is definitely something that's refreshing and can hydrate you. However, there's air in the can, so that wouldn't count towards hydration. So if you have one a day, that's great, and you can enjoy it. And it can hydrate you to an extent. However, it should not be your primary source of hydration. Incorporate more fruits and vegetables. We always want to make half of our plate non-starchy veggies, fresh or frozen. Eating a diet high in fiber just to help general GI health. Practice deep breathing and or meditation, making time for rest, relaxation, and recovery, and making sure that we have sleep as a priority. We want to aim for no more, no less than 7 to 9 hours a night. And then, of course, getting on a good exercise routine. So a general rule of thumb is 150 minutes of a physical activity each week. But of course, that's going to vary, patient to patient, depending on your medical history. So that's it. Thank you everyone for joining. I do have time for a few questions, so you can type them in the Q&A box, but be sure to check out our website and research the services that we offer. We also have social media, so follow us on Instagram. We offer a functional medicine Instagram live every Friday. This Friday, it's on diet culture if you're interested at 12 p.m. So if you're interested, give us a follow. But again, thank you for joining, and let's look into the question box. Can you provide the presentation to us? So yeah, this was recorded, so you guys can get a copy of that. Is there a protein bar that you find helpful for snacks on the run? Protein bars can definitely be a great option for an on-the-go snack. It is important to look at added sugars because those are definitely one of the packaged products that can sneak those in pretty easily. So a rule of thumb for me is I always make sure that there's more than 10 grams of protein in a protein bar, and that there's less than 3 grams of added sugar. There are plant-based sources of protein bars. There are animal-based sources like the whey protein bars. So whichever ones that you guys like would be good if it has less added sugar. Are bell peppers considered a fruit or a vegetable? Those are a vegetable. I'm doing dry January. How can I take advantage of this time to detox my liver? So our liver naturally has a detoxification process. So of course, avoiding alcohol is going to be really good to get those liver enzymes down. So that's awesome. Other than that, cruciferous vegetables are really good to help detox the liver as well. Broccoli, cauliflower, Brussels sprouts, cabbage, incorporating those into your lunch or dinner routine would be a really good pro for that also. What was your general fresh fruit and veggie recommendation? So of course, I always just recommend half the plate non-starchy vegetables. So those are going to be vegetables that aren't potatoes or squash, things like that. We want to get our green leafy vegetables in, and then getting them each at snack times. So I always recommend protein and veggies with your snacks. But everyone, of course, has different needs. So we do offer free 15-minute consultations if any of you guys have more specific questions or want to go over lab work or get blood drawn to see if there's anything more specific that we can touch base on with you. So yeah, but that's all the time I have today. If you guys do have any other questions, call the clinic and set up a 15-minute consult. But thank you guys for joining and enjoy the rest of your day.